Assalamualaikum and good morning to all our online viewers. And Selamat Hari Raya. Welcome to the National Institute of Health CME session for this year. We are now live on NIH Ministry of Health YouTube channel. Don't forget to subscribe to our channel and hit on the bell button to get our latest update. So for today's session, we will be talking about burnout and quality of life of Ministry of Health healthcare workers stationed at MIEPS 2.0. Over here with me, we have Dr. Muniamal Krishnan from Institute for Health Management to share on the topic. But before we go further into the discussion, let's take a look at the corporate video brought to you by IHM.
The healthcare industry is continually evolving, which poses new challenges in the world today. The need for health management arises with advancing technological innovations, changes in healthcare regulations, and ever-rising patient expectations. Marking its success since its humble beginning in 2000, the Institute for Health Management is part of a remarkable journey that many can attest to. We are committed to being a research and training hub, as well as providing invaluable consultancies to fulfill health management needs in delivering and managing quality healthcare in Malaysia. Throughout the years, our evidence-based health management researchers strengthen decision-making and facilitate vital policy formulation and implementation throughout the Ministry of Health. Since 2006, we have conducted over 650 courses and have empowered over 30,000 individuals. Our goal is to guide you to grow into your full potential and to maximize your performance. We impart the relevant knowledge, technical skills, and organizational mindset to healthcare managers through consultancies leading the way to achieve a transformed healthcare system. We are comprised of 3 centers, which are the Center for Leadership and Professional Development, the Center for Organizational Excellence Development, and the Center for Clinical Governance Development. Our talent grooming program, TGP, enriches the process of building leadership capability and inculcate other qualities among potential technical healthcare professionals. We take pride in producing innovation by developing TGP and MyTGP, which officially became intellectual properties of the Ministry of Health. Our initiatives in research in optimizing hospital services and issues of overcrowding led to the innovation of Cluster Hospital. Cluster Hospital is a concept where all nearby government hospitals share and expand their medical resources, services, and expertise. We have been involved in the training, implementation, and evaluation of cluster hospital initiatives since 2012. Lean thinking is about eliminating waste in work processes and optimizing available resources. It was introduced as part of the government's effort to improve efficiency and tackle issues of overcrowding in public hospitals. IHM is the Lean Center of Excellence for research, training, and consultancy in the Ministry of Health. We take pride in our involvement in high-impact health management research. The housemanship training and its associated research projects set off a ripple effect where it has been translated into policy and implemented into the Malaysian healthcare system. Over the years, we have fostered partnerships with numerous local and international agencies. Our mutual aim is to promote and support excellence in healthcare by building collaborations. We grow in strength, in line with a vision of striving towards the center of excellence in health management. The Institute for Health Management, or IHM. Better solution through research.
Hi everyone, welcome back to our CME session. And hi Doctor, how are you today?
I'm fine, thank you. How about you?
I'm doing pretty well. So Doctor, why don't you give a brief introduction of yourself to all our online viewers?
Okay, hi everyone. Very good morning. I'm Dr. Muniamal Krishnan, Medical Officer from Institute for Health Management from Center for Organization Excellence Development.
Thank you, Doctor. So, before we start into our discussion on this particular topic, so maybe you can give a brief recap on COVID-19 pandemic because before we start our discussion, so maybe a lot of our viewer needs to know a little bit about COVID-19 pandemic.
Okay. So before I start with the brief introduction, I would like to introduce my team members. Me, Dr. Muniamal Krishna, as the PI of the study, and they are my team members. Okay, so we go into the COVID-19. So as we all know, coronavirus disease, COVID-19, is an infectious disease which caused by the SARS-CoV-2 virus originated in the city of Wuhan, China in December 2019 and rapidly spread to other countries around the world. So Malaysia reported its first COVID-19 positive case in January 2020. So in Ministry of Health expanding effort to counter the COVID-19 infection, a professional hospital was organized in Agro Exposition Park Serdang, or MIEPS, in coordination with the National Disaster Management Agency, NADMA. So we see about the MIEPS. Actually, MIEPS are located in Selangor and is primarily served as a center for agro-based activities and an exhibition center with a vast landmass. So following pandemic, it has been converted into a quarantine and low-risk treatment center in April 2020 to quarantine categories 1 and 2 COVID-19 positive cases. In July 2020, MIEPS 1.0 closed its operation, however, resumed operation as MIEPS 2.0 on December 2020, as the spread of the disease was unabated and the country entered the third wave of pandemic. So, we just go look at the layout of the MIEPS 2.0. So, there are 7 halls was prepared to accommodate the patient. So all A to F able to accommodate 7,914 beds in a 40,000 meter square area. So all A, B, C, D1, D2 and DG with existing facilities, and the halls were set up in stages according to the demand of cases. So all F actually was established as a temporary facility to accommodate more patients. And the last one is Maria, or MIEPS Acute Resuscitation and Isolation Area. It's a tent. It's a negative pressure tent to stabilize critical patients before transport them to the tertiary hospital.
Thank you, Doctor. So, what are the objectives of this study and how was it conducted?
Okay, we go for the objective. The general objective of my study is to assess the prevalence of burnout and quality of life and its associated factors among Ministry of Health healthcare workers in a COVID-19 quarantine and low-risk treatment center, MIEPS 2.0. So I have 3 specific objectives. The first one is to assess the quality of life and determine the presence of burnout among Ministry of Health healthcare workers. Second, to determine the association between respondents' characteristic and the severity of burnout and degree of quality of life. And the third one, last, to describe the practices related to the management of human resources at the center. So now we go for the methodology. The study design is cross-sectional. The period was from September 2021 till May 2022. The study population is Ministry of Health healthcare workers at MIEPS 2.0. And study site, yes, it's MIEPS 2.0. There are inclusion criteria for the healthcare workers. All categories of healthcare workers Second, Ministry of Healthcare Workers ever worked between September and December 2021 in MIPS 2.0, and last, permanent and contract posts. So we also have two exclusion criteria as Ministry of Healthcare Workers who were only at MIPS 1.0, and non-MOH or other agency workers such as PDRM, ATM, RELA, Redicare, Bomba, and others. So we have chosen 3 study tools for this study. So the first is Copenhagen Burnout Inventory, CBI, World Health Organization Quality of Life Assessment, Worker Breath, and last, checklist for the management of health workers in response to COVID-19. So we done the data collection by online survey for healthcare workers and the checklist for head of division. So we go about the study instruments. We use 2 tools for the healthcare workers. So Copenhagen Burnout Inventory, 19 items with 3 dimensions, personal related, work related, and client related. And Worker Breath, 26 items with 4 domains: physical health, psychological health, social relationship, and environmental health, and overall question. So, checklist for the management of health workers in response to COVID-19. This checklist filled by 4 division representative: clinical, administrative, nursing, and assistant medical officer. It contains of 8 domains or essential actions. So the 8 are: first, mapping availability, needs, and gaps in health workforce capacity; recruitment of additional healthcare workers; reorganization and role distribution of health workforce; contractual, legal, administrative, and other consideration to enable rapid response; communication and coordination; training and skill enhancement for health workers; safety and protection of health workers; mental health and psychological support for health workers. And each domain is an intervention which done by the management.
So, Doctor, when we talk about healthcare workers, right, we are talking about doctors, nurses.
Yes.
What are a few other examples that include in this study?
Paramedics, assistant medical officer.
Okay, all right. So that's quite a diverse background.
Yes.
So maybe, Doctor, you can share with us the finding of this study.
Okay, so we go for the findings of this study. The samples that we obtain is 377 healthcare workers. Okay, so the respondents' characteristic includes socio-demographic, professional, and working characteristic within MIPS 2.0. So we see about the socio-demographic characteristic first. So the highest response is from single Malay females who is less than 40 years old, who with no children, and with educational background with diploma and certificate. Okay. And if we go for professional characteristic, clinical nurses who is not first posting at MIPS 2.0 and from Ministry of Health hospitals with less than 1 year service in Ministry of Health and with no comorbidities and perceive having a good child support response highest in professional characteristic. Okay, so we go for working characteristic. Healthcare worker who given orientation and frequency of training less than 10 and worked in multiple stations with working hours less than 60 hours is the majority. So here I would like to just explain the single station and multiple station. So single station refers to the worker, healthcare worker, work at only one hall. We have 7 halls, right, as now. While multiple stations refers to the healthcare worker having to work at several halls catering to various categories of patient. Okay, so I have 2 pictures. This is we are very fortunate enough. We saw the tent Maria, the MIPS acute resuscitation and isolation area, because at that time Maria was only available in MIPS 2.0 and at Langkawi. So we were very fortunate enough to enter the Maria that time. So the second is one of the hall. This is just a nurses station. Patients are admitted after the class. So due to the risk of infection, we were advised to avoid contact with patients by not entering the hall where the patients were admitted. So we go for the next findings, the prevalence of burnout among healthcare workers. So majority of the respondents reported no burnout in personal, work and client related. So among those who experience the burnout, the highest is in personal related burnout. As you all can see, the percentage is 31.6 compared to work and client related. Okay. Rates of self-reported overall perception of health and QL. So most of the respondents perceive their overall health as satisfied or and very satisfied, and overall quality of life as good and very good. Okay, so the significant burnout related to personal, work, and client related is associated with socio-demographic characteristic such as age category, educational level, and years of service. Okay. If just ethnicity is, we can see is significant in work related and client related, and children is significant in work related. Okay, and if we see the quality of life, show the significant association between age category, years of service, and these two in all the four domains of worker breadth. But there are also other factors, just association factors as weekly working hours, educational level, prior workplace, frequency of training given, and lastly the adequate child support. Okay, other than that, we also done Spearman's correlation coefficient between CBI, Copenhagen Burnout Inventory, and worker breadth scores. So the higher the score in CBI indicate burnout, while higher score in worker breadth indicate better perception of quality of life. So there was statistically significant, moderate to strong negative correlation between the quality of life and the burnout domains. And the highest correlation was found between physical health and personal burnout. Okay, that's the result on CBI and quality of life. So we go for the checklist. So 8 essential action and intervention related to management of human resource and for health. So in the 8 essential actions, 5 essential action actually fully met 100%. While 3 remaining essential actions got 95.5%, 73.7%, and 41.7% respectively. Okay, that's my result. Done.
Okay. All right. So, Doctor, we were talking about a type of burnout. So maybe you can give a little bit of example. What does it mean by personal burnout, work-related burnout, and client burnout?
Okay, we have 3 types of burnout: personal, work, and client related. So the burnout is contributed by personal factors, working related, or client related. In our method, our client is our patient. So is named by the contributing factors.
Oh, contributing factors. So okay. So moving forward from the results. So how do you explain all the results that you have presented just now?
Okay. So we go for the discussion. Okay, sorry. Okay. As a overall, the prevalence of burnout among the healthcare workers at MOH 2.0 is low, less than 50% across all 3 domains: personal related, work related, and client related burnout. And all 3 domains of CBI, personal, work, and client related burnout were found to be statistically significant related to age category, education level, and years of service. The respondents' quality of life is highest in social relationship and lowest in psychological health. Age categories and years of service, Ministry of Health were significantly different among their group across of all the domains of quality of life. MIPS 2.0 Human Resource Management has shown precedence by giving orientation and providing training for recruited healthcare workers. Reassigning for rotation of stations among the appropriate healthcare workers was also effectively carried out. The majority respondents received proper orientation at the deployment center but varies in frequency of training.
So thank you, Doctor, for the discussion and explanation. So we are moving into our conclusion for this study. For all our online viewers, if you have any question, don't forget to drop your question at the link provided at the description. And I think there's a QR code as well for you to scan your question over there. After we're done with the conclusion and our way forward, so we will try our best to answer all questions from our online viewers. All right. So, Doctor, what is the conclusion from this study, and maybe there is a way forward or any recommendation that from this study can suggest to our viewer and maybe our stakeholders as well?
Okay, so our conclusion by this study is Ministry of Health healthcare workers stationed at MIPS 2.0 during COVID-19 pandemic experienced some degree of burnout with relatively good perception of quality of life. Age, education level, and work experience were major influencing factors for developing burnout. Overall, Ministry of Health healthcare workers at MIPS 2.0 was managed sufficiently according to the checklist for the management of health workers in response to COVID-19. So our recommendation is the healthcare workers, the annual leave and all maintained and managed well in MIPS 2.0, but in future, maybe it can re-evaluated and look better for that. And this time, our study just done in one quarantine center. So future studies can, in case touch wood any pandemic, they can do more. They can cover more stations for their study.
Okay, thank you, Doctor, for your presentation and for your sharing knowledge this morning. So, of course, we would like to say congratulations and thank you to all our healthcare workers that have been working very hard throughout our pandemic and also in MIPS as well as other hospitals. So, I think we already have some questions. So, just okay. I'm gonna have okay, all right. Okay, so we do have a few questions over here. First, we have a question from Dr. Kavita Jetli. Please explain the strategies on data collection done as online survey.
Okay, we appointed around 5 liaison officer for us to help to do the online survey, where we develop the questionnaire in a Google form and we share the link with the liaison officer. So the liaison officer will share the link with all the healthcare workers in MIPS 2.0. And that's one strategy. Another one is we met the team leader from the 7 halls. So we have a discussion with them and we even pass the link to them because they have their own WhatsApp group according to the hall. So we even pass the link to them so that they can pass the link to the healthcare workers in that specific hall. Other than that, we also pass them the QR code printed so that they can fix or stick on the wall in the nursing station and the pantry where the healthcare worker can see, and they just have to scan the QR code to answer the survey. That's the strategies that we did to get the survey.
Okay, all right, thank you. So next question we have from Nurul Ain binti Amran. How many intervention is in the checklist?
Okay, it's very long. It's around 8. We have 8 domains, and each of them have like majority around like some having like 12, 20, and if we calculate the total is around 88. 88 if we calculate all the 8 domains.
Okay, so that's quite a
Yes,
large number.
but it's just the checklist only filled by the 4 head of divisions of MICE 2.0.
Okay, all right. Okay, moving on to the next question from Encik Ahmad Faiz. What is the mental health and psychosocial support for health workers prepared in MIPS 2.0?
Okay, it's a very good question. I didn't explain about that. Okay. At MIPS 2.0, they have a psychological officer standby there. Okay. So even before the healthcare worker come to done a reporting in MIPS 2.0, they will do a DAS screening to screen the mental health of the healthcare workers. And in case during their working period, if the staff feels is stressed or having some problem, they can approach the psychological officer.
So
that's how the MIPS 2.0 maintain the healthcare workers' mental health.
Okay, all right. Okay, and then we have one last question from Kahyi. Thank you, Dr. Munyamal, for sharing your finding with us. It was a very informative presentation. I'm interested to know, how did you score the checklist? I think checklist has been a popular question for today.
Okay. So as you all can see, we have 8 domains here, and each domain contains of intervention questions. So as I said to Miss Ain, is it? There are total 88 questions. So but the checklist was analyzed by giving 1 point assigned to the intervention answered yes by the majority of the respondent. It can be 3 individuals or more lah, because it's answered by 4. And if an intervention was scored yes by 2 representative and no by another 2, then the intervention was not given any mark. So it will be 0 lah. So the cumulative marks were then converted into the percentage according to the each essential action. So that's the percentage that we put there.
Okay, all right. So I hope that answers everyone's question, and I think we're done for today.
Oh, okay.
If you have any other question, maybe our online viewers have any suggestion or comment, they can feel free to drop you an email at IM.
Yes, okay. Okay, my email is muniamal.k@moh.gov.my.
All right. Thank you so much, Doctor. And thank you again to everyone online viewers.